Casting is one of our primary treatments when we have a curve that needs to be effectively corrected. And the ideal time to start is probably around the age of 1 year, because the younger the child, generally the more flexible the curve. The cast is put on under general anesthesia for two reasons. The first is we don't want the child to be struggling or uncomfortable during the application. And the second is that under anesthesia we can apply traction. And this is done on a special casting table. And with the traction we also mold from the side of the chest where the curve is, so that we can get additional correction by the molding process. The idea that we're going to improve the curve as much as the flexibility will allow. And at the end of that period of time, you should have a pretty good idea that you've accomplished your goal. The goal may not be a completely corrected curve, but something which is reduced to a point where part-time bracing might be appropriate, or simply observation. There are large windows cut in the cast to minimize the possibility that there's circumferential constriction of the chest or the abdomen. And once we know that the child is breathing okay, the next step is to get them up if they're ambulatory and make sure that they can walk around. The idea is that by having them move around, we can detect if there are places where the cast is rubbing or too tight or needs to be trimmed some more to give them an adequate amount of freedom to move. And usually after a couple of hours of observation and moving around, they're good to go. I make a deal with the parents that if we're going to do this, I need their commitment to be part of it for a year so that we can direct the growth of the spine for that period of time. Because I think that's what it takes to change the growth direction from curved to straight. And that's what we're going for. The rationale for casting is two things. The first is that it changes the dynamic of the treatment from the parent enforcing the treatment to the doctor enforcing the treatment. So, by transferring the method of enforcement to the doctor, the parent is relieved of the responsibility and the angst of having to do this. And the second reason is a brace that is worn all the time, which is what a cast is more effective. We know from many bracing studies that brace effectiveness is dose related. So the longer you wear it, the better it's going to work. We know that braces that are worn less than 12 or 13 hours a day are useless. They don't do anything. We know that braces that are worn 18 to 20 hours a day are far more effective. So therefore, if we have a brace that we're going to wear 24/7, imagine how effective that can be.